How to treat neck and back pain naturally. Back and neck pain is a common complaint and can be caused by various issues, including muscle strain, ligament sprain, jammed spinal, facet, joints, disc herniations, pinched nerves and degenerative diseases such as osteoarthritis. The most common triggers for back and neck pain are overdoing it, poor posture, too much sitting and/or high levels of stress. However, most cases of spinal pain can be treated naturally, either at home or in the hands of a health professional. Only a minority of cases require medical intervention. 1. Rest and give it a few days. Most back and neck pain occurs when you lift too much weight, perform repetitive movements too often, move awkwardly or experience a trauma. However, sometimes spinal pain develops by spending too much time on the computer or sleeping in an awkward position. It can often be difficult to understand or predict the cause because the human spine is very complex with lots of moving parts. 2. Do some light stretching. Whatever is causing your neck, back pain, chances are that the muscles are guarding, which means they're tight and restricting movement. Thus, as long as you don't feel sharp, electric or stabbing pain with movement, then lightly stretching the tender area is likely of benefit. Sore and tight muscles respond well to stretching because it reduces tension and improves flexibility or range of motion. 3. Consider changing your sleep position. Although everyone reacts a little differently, some sleeping positions are much more likely to cause pain than others. For example, stomach sleeping is a common cause of neck and back pain. The neck tends to get twisted to one side and the low back can get hyperextended and irritated. The best sleeping position for your entire spine is either on your back or sides. 4. Apply ice to an acutely painful neck or back. If your sore neck, back developed recently and feels inflamed and stiff, then place a bag of crushed ice on the most tender part in order to reduce inflammation and numb the pain. Cold therapy is most effective for acute injuries that involve swelling because it reduces blood flow by constricting local blood vessels. Apply the crushed ice for about 15 minutes 3 to 5 times daily until the soreness in your neck back subsides or fades away. 5. Apply moist heat to a chronically painful neck or back. If your tender neck, back has been bothering you for many weeks, then it's considered a chronic injury. Avoid cold therapy for chronic injuries and use some source of moist heat instead. Moist heat warms up muscles and other tissues by relaxing local blood vessels and increasing blood flow. It can be helpful for soreness caused by old sports injuries or arthritis. A good source of moist heat is small microwavable bags filled with grains, herbs and/or essential oils. 6. Use herbal remedies for pain and inflammation. If you are trying to avoid using medications for your neck or back pain, then consider herbal remedies to help ease your discomfort while your body heals. Creams, lotions and/or ointments containing menthol, peppermint, camphor, arnica, capsaicin or lavender can be helpful for relieving musculoskeletal pain, although results can vary depending on the strength of the product and how it's made. Rub some into your neck or back 3 to 5 times daily and see if the pain or inflammation is reduced. 7. Get a professional massage. Virtually all spinal pain involves the muscles to some extent, so addressing the tight or spasming muscles is a good strategy for naturally relieving neck or back pain if your budget can afford it. A deep tissue massage is helpful for mild to moderate strains because it reduces muscle spasm and inflammation while promoting relaxation. Start with a 30-minute massage, focusing on where you feel the majority of your neck or back pain. Allow the massage therapist to go as deep as you can tolerate it without wincing. 8. Look into trigger point therapy. Muscle knots, or trigger points, can sometimes be responsible for up to 30% of all pain. These are tender areas in the neck and pain that can produce local pain or pain that extends to other areas. Applying pressure to these muscle knots for several seconds is an effective way to treat them. 9. Consider relaxation therapies or activities. Stress-relieving practices such as meditation, deep breathing exercises, biofeedback, positive visualization and Tai Chi has been found to help alleviate a wide variety of musculoskeletal pain and even help prevent injuries in many people. Yoga is also great for relaxation and involves practicing specific postures or poses along with doing helpful breathing exercises. I hope you liked this video. If this video was helpful to you, give it a thumbs up, and share it with your family and friends. Please remember to subscribe my channel to see more videos like this in the future. Thanks for watching.